Hi, Happy New Year to everybody. I'm Dr. Dan Rubin, and I'm here with another episode of Ad Hoc with the Doc. We're here today with my colleague, our teacher, environmental medicine mentor, Dr. Walter Crinnion. And Dr. Crinnion, who is the expert in environmental medicine in the naturopathic medical profession, but regarded as an absolute environmental medicine expert worldwide, is here. We both work at Naturopathic Specialists. We see patients together. Really, thanks for being on this episode. I'm really excited to talk about this subject because I'm not as knowledgeable about this subject as you are. It's fascinating. I myself try to live as cleanly as possible and try to reduce the amount of environmental intoxication, whether it be geopathic stress or electrical stress or chemical stress or in my water or in my food. And I'm just excited that there's so much happening in the world. There's so much recognition of what our bodies are being bombarded with. And it's really nice to be able to, talk to you and, be able to ask you questions, and hoping that our audience has some questions for Dr. Crinnion as well. But Dr. Crinnion, tell us how you initially got interested in environmental medicine.
Well, one of the basic tenets of naturopathic medicine is treat the cause. So when I was in the beginning of my practice, and I had a family practice, womb to the tomb, I got people with chronic illness finding out what was causing it, and in many cases it became that they were having reactions to the foods that they loved and ate all the time, and it was causing their migraines or their asthma or angina or arthritis. So I was able to identify that and say, okay, stop eating the wheat and the dairy, and you won't have that. But what was the cause of them having that reaction? And the deeper I got, the more I found it was environmental burden. And as I started going down that rabbit hole, then I began to have people who had other environmentally related illnesses like chemical sensitivity, which is now so common. You ask anybody, do you have a trouble walking down the soap aisle in the grocery store?
I do.
Sitting by someone with perfume. Yeah, that's environmental illness.
Yeah.
And so now it's common.
That right there could be considered environmental illness.
Oh, it's absolutely considered environmental illness.
Very interesting.
That's right.
Because so many people are sensitive to perfumes, or like you said, have trouble walking down the soap aisle or the detergent aisle in a big grocery store. And most people probably are like, that they don't really realize the impact that has on their body. But that is a significant issue then.
Correct. Wow. Correct. And what I find is that when they have that, I find out when it started and when it got worse. Okay. Getting worse means, now they're also reacting to this other substance and then another substance. And I find out in their history when it began and when it got worse. And then I look at the problems they're actually coming to me to talk about. Their autoimmunity, their arthritis, their brain fog, their Parkinson's, whatever. And many times those other diseases, the starting of those other diseases line up right at those same time periods. And then I know, okay, this other disease is also a manifestation of the environmental burden. And by finding out what they reacted or what they were reacting to at those times, I know what the chemical was, and I just identify the source. And that's the first step.
That's actually very incredible.
Identifying the source, and then remove the source. And quite often, all you have to do is identify where it's coming from and get rid of it. And within a few months, their health is recovered. Because most of these environmental chemicals are not persistent. It's not like when I was growing up and DDT was being sprayed, which stays in our body for decades. Most of these chemicals today have very short half-lives, so you pee them out within a day or two. So if you stop exposure, they're all gone.
So that is a very important point. Something that most of our listeners probably know about are plastics, and plastics contain at least one substance called phthalates, or a lot of plastics do. Now I know there's
Correct.
Other substances, but that's the big one. That's in the news. That's what people are familiar with. And phthalates can be recovered in the urine.
Absolutely.
And so you're saying that if somebody, and I don't know if this is the case, but you can interview somebody And with the history that you take, if you determine that phthalates may be the cause, and if you teach them how to modify their lifestyle and remove phthalates, that they can get better? from their
Absolutely.
symptoms?
Absolutely. Let's just talk about phthalates for a minute.
Okay.
There's two kind of phthalates, what's called high molecular weight and low molecular weight. And
Okay.
one is common in all fragrances. Every fragrance product out there has phthalates in it. And then the higher molecular weight phthalates are in things like vinyl flooring, shower curtains, saran wrap, those types of things. So
Do
phthalate...
they make things stretchy?
Yes, they make the higher molecular weight that are in plastics make things flexible. So the more flexible the plastic, the more the phthalates that are in there.
More phthalates, and then the more the plastic flexes, does that release that plasticky smell?
Well, yeah, the phthalates aren't bound very tightly
Okay.
to the plastic, so they pop off really easy.
What about water bottles that are real flimsy that you buy?
The flimsier they are, the more phthalates in
Okay.
them. The firmer they are, the less.
And they can go into your water.
Oh yes, yes,
Okay.
absolutely. So there have been a number of different illnesses, chronic illnesses, where they have looked at. They just measure the pee. What's your level of phthalates in your urine? So the higher the level of phthalates in the urine, the bigger the belt size. They're associated with obesity.
Phthalates are associated with obesity,
Yes,
meaning that reducing or eliminating plastics, phthalate-containing plastics, can help people lose weight.
absolutely. So they're mostly endocrine disruptors. So obesity, diabetes, type 2 diabetes, and all these young men in their 30s and 40s that have low testosterone. So they have testosterone that previously you wouldn't see until someone was in their 60s or 70s. And so now you have all these young men with infertility, erectile dysfunction, fatigue, depression from low testosterone. That's directly related to phthalates as well as outdoor air pollution.
Because we had Dr. Wade on the show too, who also we all work together here at Naturopathic Specialists, talking about, and I know a lot of it she learned from you too, from your classes at Southwest College of Naturopathic Medicine, but that a lot of people with low T or symptoms of low T don't necessarily need injections of testosterone, but like you're saying, like she said, could remove certain environmental toxicants that are endocrine disruptors, and the body can heal and is not obstructed. And it's kind of a naturopathic concept.
Absolutely.
Phthalates are exciting, and they're rampant.
They're everywhere, but they're easy to avoid.
Interesting.
They're very easy to avoid.
Well, I love that subject. Environmental medicine it's such a big subject, and it really hits home for people because every day we are exposed to plastics. It'd be very difficult to not live in the modern world and completely avoid plastics. I mean, in your home, obviously, this is a glass table. We have glass desks, non-plastic desks. We might have metal computers, but still they're in our systems. They're in our water supplies.
Right.
Are they in the air?
Well, certainly around factories making them,
Okay.
they're in the air.
So if somebody lives near a plastic plant, speaking of air and air quality, you and I live in Arizona, metropolitan area, and I don't know a whole lot about it, but I know you do. There's something called PM, or particulate matter.
Correct.
What
Particulate
is
matter.
that?
So particulate matter, it's actually carbon, pieces of carbon,
Okay.
that is released from burning fossil fuels, but also from wood.
Like gas.
Yeah. So if you've seen a big cloud coming out of a diesel truck,
Okay.
that's particulate matter. Now that is very big particulates. So they measure particulates by size.
Okay.
And diesel puts out the whole range from what's called ultrafine, teeny, to coarse. And that's what you see in the cloud. The smaller the particulate, the worse the problem. But particulate matter
Right.
from urban air pollution, vehicular exhaust, which even though we're in an office building, we're still breathing, although you might not because you got this fantastic filtration system
The ion
here.
air, indeed.
Yeah. So, but that is associated with the list of diseases that this particulate matter is clearly in the medical literature causing cardiovascular disease,
Wow. I would never have thought that.
obesity, diabetes, just like the phthalates. If mice are exposed to high particulate matter, they get fat. infertility,
Wow.
autoimmunity,
Wow.
neurologic problems, including Alzheimer's. They've done studies. Lillian Calderon-Garcinetis from University of Missouri, go Grizz, she's been doing studies in Mexico City looking at kids in areas of Mexico City exposed to very high PM 2.5 versus areas where they're not. The kids with the higher exposure already have the pathology of Alzheimer's developing in their brains
How old are they?
between age 5 and 10.
That sounds like a train that's really difficult to stop.
That's a train. Well, interestingly enough, not so much.
Indeed.
Indeed. One is air filtration. I was really working with her trying to get IQAir to fund this study for the kids in Mexico City, and I couldn't quite get it to happen. But if you have a good air purifier in your bedroom, you can drop that dramatically. But the natural antioxidants also work, like the berry pigments are able to cross the blood-brain barrier and prevent the inflammation in the brain that leads to this development of Alzheimer's.
Very interesting. So even if somebody can't get out of that city or they're powerless to reduce the amount of PM 2.5 or above that they may be exposed to, they can reduce their risk by maybe engaging in a diet high in berries or berry pigments, which the pigments are the things that, say, would stain your clothes if you rub them on them, or like beets, like red beets, those types of pigments?
Well, probably the red beets. I haven't seen studies on the beets, but the actual pigments in the berries, absolutely.
So blueberries and blackberries, raspberries, strawberries.
Right. And they're best if they're actually frozen, because freezing breaks the cell wall and allows the pigments, more of the pigments to be released.
Oh, because the pigments are in the skin. And how many people really chew a blueberry well? They really pop them in and down the hatch, so they're not really getting the benefit. Very well. Well, that's a great health tip. And so for people out there, for people living in the urbanized areas or maybe living near a highway or in a jet pathway or near an airport, perhaps this is great advice. Check into your diet and take a look at your
Well, also think about an air purifier, because one of the things I didn't mention is there are a number of studies both in Los Angeles and in the eastern part of the country where the closer a woman lives to a roadway with truck traffic, the greater her risk of having a child with Alzheimer's. And if she stays living in that home with the kid, the child's autism.
Autism.
Autism,
Let's
a
back
child
up
with
and say,
autism.
The closer the woman
Lives to a busy roadway with truck traffic, diesel exhaust, the higher her risk of her child being autistic. If that child stays living there, the autism gets worse. And plus, the air pollution, the same stuff, can cause infertility. So I tell people, spend the $1,000 to get an actual quality air purifier in their bedroom. It's far cheaper than trying to go through in vitro fertilization, and far cheaper than having a child with autism.
Another great tip. So, Dr. Crinnion, are you saying that there's studies that demonstrate that if somebody has an autistic child, that perhaps moving away from a high truck traffic area may help reduce the symptoms of autism that child is having?
That's what the studies have shown, that if that kid keeps living there. So, and the autism rates are exceptionally high. Now, we're having a Dr. Scott Faber come to our Environmental Health Symposium, which will be here in Scottsdale.
When?
First weekend of April in 2018.
And that's for physicians?
For physicians and interested others.
Okay.
He did a study on clean bedrooms, giving autistic kids an environmentally clean bedroom and seeing improvement. We're also having Jim Adams come and to present his research on when they did probiotic replacement with autistic kids, and not only saw their GI symptoms improve, but saw them improve neurologically as well.
I mean, this is a huge topic. Environmental medicine is it's where we're living. I don't know the rates, but I do know that we're in sort of a chemical revolution, if you will, and that are there accounts or are there figures about how many new chemicals are being introduced into our environment each year or each decade, or is it an increasing rate? Is there any data out there that you know of that demonstrates that we're just using more and more because there's more and more populace, we're trying to feed people, we're trying to keep things clean?
Yeah, there's the EPA has approved over 90,000 compounds for daily use.
90,000?
For production in this country. And there are over 3,500 high-use chemicals. That means excess of 1 million pounds a year of them are made.
I mean, it's amazing what our bodies have to go through. And none of us are genomically the same. Some of us
Correct.
handle the environment differently. You know,
And unfortunately, those genetic differences are present in 50% of the people. The ones that really affect your ability to clear these compounds out are present in 50% of the people. Again, fortunately, those are modifiable with natural compounds.
You know, I know we only have a few minutes left, and I'd like to invite you back for maybe even a part 2 or something, because it's such an expansive topic, and it really hits home for people, obviously. But a couple things I'd like to cover is I'd like to touch upon glyphosate. I'd also like to talk about some of the testing that you do, a naturopathic specialist, because I know I refer patients to you when I know there's environmental issues that I don't know how to manage, or I don't even know how to test or even talk about, and you manage them so nicely and people get better. What type of testing, do we do? And then I'd also like, I know you have a podcast, and I think it's a valuable podcast, and I think people, our audience should know about that podcast. So if we could maybe hit a minute or two on each of those before we end the show today, I'd love to.
So thank you. My podcast is called Crinnion Opinion.
Okay.
CrinnionOpinion.com.
All right.
And it's a monthly podcast, a subscription, $25 a month for basically a week of my time reviewing articles and putting them together in an understandable form, which is a strength that I have. And so the November Crinnion Opinion, I reviewed studies from U.S. and different countries around the world on what is the average glyphosate level. And glyphosate is Monsanto says it's the active ingredient in Roundup, but it really isn't. But it is in all Roundup products. And I reviewed in November how the levels that are found in people around the world in their urine.
Bodies, in their
urine. Yeah.
So it comes out.
It comes out. It's water soluble. And so then in December, I reviewed. There aren't many articles on it. There are very few, but I reviewed all that I could find on glyphosate levels in food. And surprisingly enough, since glyphosate's used in high amounts on Roundup Ready oats, soy and corn, because those plants are resistant to glyphosate, so they can spray the heck out of the fields and kill every weed and reduce the competition for the nutrients. It's not really found that much in those. It was higher in oats. Oats. Believe it or not.
Interesting. So non-organic oats or just oats, or we don't know?
They didn't. There's not enough data on that. But I was thinking now, how can that account for all the glyphosate we're finding? Especially because I know some people at high levels that are, everything they eat is organic. And by the way, it was not found in organic soy. It is found
That's a big deal.
It is found in regular soybeans, but not in tofu or soy milk. Okay.
Excellent point.
Yes. So then I looked at, and it turns out that glyphosate, which is so highly water soluble, is found in surface water, so rivers, lakes, streams.
Pools?
Pools, it could be, certainly. But rivers, lakes, and streams, they didn't test pools.
Okay.
Groundwater, so where aquifers, wells and that
Yes.
kind of stuff, it's found in seawater, and it was even found in the one study where they looked at bottled water. So I think that water is a big source of that as well, which, by the way, if you live in Arizona, you should have, not only if you're in the Phoenix area, an air purifier, like I've got an IQ or Health Pro in my bedroom, but you need to have RO water filter on all the water that you drink and use to cook with, because here in Arizona we're a high arsenic state, which if you're using this water for 3 or 4 decades, your risk of cancers is huge and heart disease is huge. We've got chromium-6 here in this state in the water, which is the Aaron Brockovich chemical. We've got perchlorate, the rocket fuel. We've got MTBE. So there's this whole host of chemicals in our water that it's got to the point environmentally. When I started, it was like, hey, take supplements, eat organic food, and you'll be good. Now it's like, you better get an air purifier and a good water purifier. Yeah. And by that I mean RO, because the charcoal filters and the canisters under the sink don't clear out these chemicals.
Big Big, huge. Well, thank you.
You're so welcome.
This has been great. Would you come back and talk to us a little bit more?
Absolutely. And I don't want you guys to freak out and think, oh, I'm going to die. Okay? Yes, the environmental stuff is scary, but you can live. You can avoid all these stuff. It's not that hard. It's easy, and all the natural products that we use, a whole food diet, reverses the effect of all these things. So it's not at all hopeless. It's just you learn a few things, you get aware, you get prepared, and you can beat this stuff.
I think people should, if they have questions, they can certainly tune in to Crinnion Opinion, or they can call the clinic here. You're available for phone consultations. Patients, naturopathic specialist is your place of practice, especially if people are having symptoms, and especially if you know that you have exposures, or you know somebody near you who has had symptoms related to exposures. I say talk to Dr. Crinnion. I think it would be very valuable for people. Thank you again.
Happy to.
Wonderful.